Thank you very much, guys, and thank you so much for your introduction. I hope I live up to it now, I have to say. I'm nervous myself. I'm delighted to be here to speak to you in celebration of World MS Day, and I'm hoping to talk to you about strategies for supporting adjustment, acceptance, and quality of life following a diagnosis of MS. The concerns and challenges I'm going to talk to you about are very reflective of what I see in my own clinic at St. Vincent's. And the coping tips and strategies I'm going to tell you about are very much what I use myself in clinical practice to support people with MS to optimise their adjustment and coping as much as possible. And so I really do hope you find them helpful. I think what's really important, again, going with the fingerprint idea, is to just be very, I suppose, mindful of acknowledging that MS looks different in different people. So before we start, it's really important to note that difficulties with adjustment and acceptance will not be problems for everyone. People will have different ways of adjusting and coping, and that's fine. And also, although the focus today is on adjustment following diagnosis, these strategies are generally helpful in boosting coping and adjustment, whatever the illness stage that you're in. In long-term conditions like MS, adjustment is rarely a kind of a linear or kind of a one-stop thing. It's often something that changes over time because your symptoms and your circumstances will change over time. So it's good to know about a set of strategies and ways of thinking about your experience that can help you whenever you might need them. They're also applicable to boosting coping for family members as well, and caregivers, and generally boosting resilience and well-being for everyone. So as I said, I'm also very nervous, and I'm going to lean into some of my cognitive strategies that I recommend to other people, and I am going to be using my notes as I go along. But that's because I want to make sure that I capture pretty much everything I have to say to you in the time I have available, because it's a lot. So bear in mind that I will be giving you a lot of information, but as I said, if there's going to be a recording available, you can watch it back afterwards for any of the bits that you missed. Okay. And I think this is probably going to build on any information that you would have heard previously at wellbeing events that have been run by MS Ireland. So if you attend any of those, some of these things might sound familiar. That's because they're good strategies and they work well. Okay. So, as I'm sure many of you know at this point, it's very normal for people and their families to find the process of diagnosis of multiple sclerosis challenging. Because MS varies from person to person, it involves a lot of complicated assessments. It's difficult to provide knowledge about what the future might hold. And because of that, this is a time that can lead to people with MS and their families and caregivers to feel a range of difficult emotions, including distress, confusion, and frustration. Now, like many other long-term conditions, MS is characterised by being quite an ill-defined illness and quite uncontrollable, and there's a lot of uncertainty that goes with it as well. So I'm feeling well today, but will I still be feeling well tomorrow, right next week, right next year? So, despite treatment advances over the past 10 years, there is no cure for MS, and people with MS will experience changes in functioning over time, and it's hard to predict what these changes might look like. And when they might occur. And furthermore, depending on where you live, it can be difficult to access information and support services. So, therefore, at this point, people with multiple sclerosis and their families and caregivers kind of don't really have much of a choice. They're kind of required to adjust to and accept the fact that they will encounter challenges over the course of the condition. And people will vary naturally in their ability to tolerate that uncertainty and to be able to adjust to a diagnosis. So research suggests that over time, most people with MS and their families adjust relatively well to life with MS. So for example, some studies indicate that people who have been living with MS for longer periods of time tend to report higher levels of satisfaction and well-being than those who have just recently been diagnosed. And they're also better at finding, I suppose, benefits in their illness. So for example, maybe being able to adapt to the condition or improvise, or maybe finding benefits in living a slower pace of life at times. So there can be aspects that people can find actually give them benefit in their life. And this suggests some ability to adapt the condition over the longer term so that it has less of an impact on everyday living and psychological well-being. And it reflects the principle known as hedonic adaptation. So after something very good or something very bad happening, and a subsequent change in positive or negative feelings, most people will return in time to a relatively stable baseline of positive feeling or happiness. So you might have a bit of a roller coaster at times, but most people will kind of return to a fairly even base. But it might take a little bit of time to get there, but most people do. Now, that said, there is evidence also to show that compared to the general population, people with MS can report higher levels of anxiety and depression and lower quality of life in the time following a diagnosis, with psychological distress experienced in the first 3 years a primary factor in reduced quality of life. And additionally, hedonic adaptation, so that idea of kind of going up and down with different levels of emotion returning to baseline, well, that can change, and it's not so straightforward maybe in a chronic condition like MS where there might be progression over time. The baseline can shift and adaptation may be required in recurring cycles. And furthermore, research specifically looking at psychological well-being in a time just after diagnosis shows that it's a time characterized by uncertainty, anxiety, and psychological distress. So people can adjust well in time, but maybe at the beginning they might need a little bit of extra support. So where a person has difficulty coping with uncertainty or difficult thoughts and emotions, or worry about the future, situations, feelings, and symptoms, they can be experienced quite aversive, and therefore it's really important to have a little bit of support to help you coping and adjusting with that. Okay. So, bearing in mind that adjustment can look different for different people after diagnosis, I have some quotes for you that reflect the lived experience of MS diagnosis. And these are quotes that either I've heard in my own clinic or I've drawn from some of the research studies that have been done. And some of these might relate to your own experiences for you guys here today as well. There might be some that kind of struck a chord with you. Okay, so the slower pace makes you stop and appreciate the little things more. There's joy in the small details. I have worked so hard to build my career, I feel so angry that I might have to give it up. I'm terrified of ending up in a wheelchair. Even the thought of using a walking stick worries me. I'm a strong, independent person. I suppose in a way I'm relieved to know that I have MS. For a while there I was convinced I had brain cancer and was dying. It was like a second coming out, only I might have to do this again and again as things progress. And then I realised my MS, like my sexuality, doesn't define me. With this disease, the only thing I can control is my attitude. So why would I want to have a bad attitude? Gosh, I might just smack the next person who tells me I'm looking well. That one resonates clearly. Sometimes my new normal looks different every day. I set up routines so I don't have to think about things so much. It leaves me more space for dealing with the unexpected. I don't want to become a burden, to let them down, or to cause them worry. There are days that are hard, but then I remember at my core, I'm still more the same than different. So there are lots of different thoughts that can go through a person's mind. Different people will have different thoughts, and the same person might have different thoughts at different times, and that's okay. But it's just to kind of give you a sense of adjustment and what that might be like for different people. So, what do we actually mean? So there's a lot of text on this, isn't it? So what do we actually mean when we talk about adjustment and acceptance? Well, these are terms that are often used interchangeably, but they describe slightly different things. So adjustment is a process that involves making changes in attitudes or behaviours as a result of, or a need or a desire to change, to account for current circumstances, the environment, or changing unexpected conditions, in order to satisfy needs in a healthy, beneficial way, demonstrating adaptive social and psychological responses to situations and demands. And I suppose to boil that down, it's like adjustment is that process that you go through to kind of come to terms with what's happened with you in getting a diagnosis of MS and finding ways of adapting around that to live your life as best you can. And acceptance then is also a process that involves living in the present moment and engaging fully in what you are doing or what you are able to do, acknowledging that symptoms can't be controlled all of the time, sitting with or holding difficult thoughts and feelings, like a thought like I'm a burden, or feelings like sadness, grief, frustration, anger, fear, worry, shame. and sometimes making adaptations to how you do things. For example, using a mobility aid or modifying the environment. We were talking earlier on about modifying the temperature of the room, for example. Again, in order that you are able to live your life as well as possible alongside experiences symptoms. And acceptance can be somewhat like a grieving process, and you might find yourself thinking about things that you might have lost, what you currently have, and how you might want to try and carry on. And I suppose overall, neither adjustment or acceptance is something that happens overnight. They're a process, and that's because MS is a complicated condition and it varies over time. And some people find this idea of adjusting and accepting MS confronting, because sometimes in order to adjust, you have to recognize that things have changed and that things are different, and that can be tough. And our adjustment and acceptance processes are very much shaped by everything that we've experienced prior to MS as well. So it can be shaped by values and beliefs, early life experiences, your own innate coping styles, the way you've managed with stress and things in the past, and your personality, how you see yourself. I'm a doer, I'm a coper, you know, what's your sense of yourself? What's really important is to know that adjustment and acceptance is not the same as giving up. What you're doing is you're accommodating MS and you're learning ways of rolling with it to make sure that you can continue to live the life that you want as much as possible. I guess part of adjusting is also acknowledging the range of negative emotions that you might experience due to your MS, but not being overwhelmed by them. So it also includes maintaining a reasonable quality of life in the face of illness, and being flexible enough to change how you do things, by altering or adapting maybe your life goals to still fit with your values. So finding a different means to the same end that you might have planned out for yourself in life. So, you know, if going into town or it is something that you value, it might be looking at different ways of getting into town when your mobility might not be at its best. And sometimes it might mean asking for help from people. That can be really challenging and difficult. But it's thinking about what's important to you and being able to go and meet people and socialise might be the thing that you value, and it's about looking at things that support those values. So this is an image called the change curve. For many people with MS, their diagnosis is part of their journey. It might not even necessarily be the start of their journey. The start might be the symptoms that you've experienced initially to lead you into that process of seeking a diagnosis in the first place. And early on, I guess people are trying to make sense of and adjust to their new circumstances with illness. So this image illustrates a change curve that was originally developed by Kubler-Ross in the 1960s. And she was doing work to try and understand the grieving process for people who were living with terminal conditions. And since then, it's been widely used and adapted to help people understand the typical emotional reactions to significant life change. So it might be for people with MS, it might be for people who've experienced a stroke or a heart brain injury or so on and so forth. We kind of use the model in the same way to help people understand their experience. So for example, people can experience anxiety following a diagnosis, and they can feel terrified about what the future holds, and they may then experience a process of denial, where they determine that this diagnosis is not going to define them and they're going to carry on as normal with life as before. They may experience frustration. Why me? Why am I experiencing this? What did I do to deserve it? Who can I blame for this? Others might experience ill mood or depression as they feel as if their life no longer has value and they're struggling to find reasons to carry on. But over the course of adjustment, people can reach a stage then whereby they're more willing to experiment and to explore opportunities in the context of symptoms that they might be experiencing at a given time or what they're able to do. They may make decisions to look forward and to assess their options for support or to assess their options for getting out and about. To learn coping strategies, to try and gain a new perspective on what holds meaning for them. And they may begin to feel a little bit more positive or optimistic about the future. And as this process continues, they begin to integrate. They begin to integrate a new sense of themselves, who they are as a person. They're more able to integrate into different areas of life, with family, with friends, in your community, and believe they have something valuable to contribute to themselves, their loved ones, and to society. And it's not unusual for me in a clinic setting to observe people moving back and forth between these stages. So as it's drawn on a curve there, it makes it kind of feel as if everyone kind of goes through those steps one after the other, but that's not actually what it looks like necessarily in reality. People can find themselves at different stages at different times, depending on where they are in terms of their MS symptoms as well. So, for example, if they experience relapse, or for example, if their MS progresses, and also indeed in relation to other life events that happen as well, because MS is just part of life. Unfortunately, people can experience a range of different challenges in life outside of that too. But they might cause you to think a little bit more about your MS symptoms. Does that make sense for everyone? Is there any questions about that one? Okay. So, Topku and his colleagues, they conducted a meta-analysis of 24 years worth of published qualitative research exploring the experience of diagnosis by people with MS. So they looked at all the different studies that have been done within that time that have asked people about their experiences and what they had found at that point of diagnosis and just afterwards. And they found two overarching themes. So the first theme that they noticed was in relation to receiving the diagnosis in and of itself. And they noticed that people reported a variety of different emotional reactions. So much like the Kubler-Ross model, people were reporting things like feeling anxious, feeling sad, feeling lonesome, feeling, worried about the future, but also feeling things like relief. And also feeling things like, okay, well now I have a baseline to start from again, and I know where to kind of begin and take a first step. So it was looking at not just the challenges that people experience, but also the more kind of, positive or adaptive emotions that people were experiencing as well at the point of diagnosis. They also looked at the external barriers or disruptions or challenges that people experience, again, at the time of diagnosis. And these might include things like feeling professionals or family members didn't believe their symptoms when they reported them in the first place, especially the hidden ones, fatigue or pain, or maybe challenges with thinking or concentration. They may have felt that there was, or expressed a dissatisfaction about how the diagnosis was handled. So, some people reported finding that, it was quite an impersonal process, or that the professional that they were working with maybe didn't hold a lot of empathy for the situation that they were in, and they found that quite challenging at that point. There was a sense in women, actually, that often they felt that at kind of those early stages when a diagnosis was being kind of considered, that symptoms that they might have been reporting were thought to be or kind of dismissed as, being emotional difficulties or psychiatric difficulties, and they felt unheard in their reporting of their symptoms. Also, around the time of receiving the diagnosis, they also looked at different things that people were reporting about coping skills and coping strategies. And on the one hand, people reported things like maybe concealing their diagnosis. They didn't want to tell people about their diagnosis, they didn't want to be a burden on anyone, they didn't want to feel pity. They were trying to maintain their sense of identity and their sense of independence and kind of push through. Whereas other people reported, actually, this is a time that enabled me to take stock of life. What was really important for me? What were ways that I wanted to move forward? Was there anything now that I had an opportunity to do differently once I had taken stock of things changing for me? So again, there were differences in coping strategies. So things that were maybe making it a little bit more challenging for people to adjust, and things that facilitated adjustment. And people would have reported different types of coping strategies. And ultimately, all people reported, I suppose, a process of a journey towards trying to make sense of having a diagnosis of MS and what life was going to be like from that point on. So kind of trying to take stock and trying to figure out a plan for the future. The other overarching theme was looking at the needs of people around diagnosis, and I suppose it's no surprise to say that both of those are really around kind of, on the one hand, a need for support around emotional processing, adapting to maybe feeling anxious, and strategies and coping skills for supporting mood management, stress management, and other things then around more kind of information in general. So looking at getting information about services, getting information about returning to work, getting information about can I drive with MS, very practical things. So what they definitely found was that adjustment wasn't, again, something that was existing in a kind of a once-off, you wake up one morning and you've adjusted to your MS. It was a process that happened over time, and people could go back and forth between different stages of adjustment, depending on their circumstances. And so I think what that kind of highlights is what people think adjustment looks like is a straight line to getting adapted and adjusted and thinking better about your MS. And then there's actually what it is, which is a bit more of a convoluted, messy type of a pathway. And sometimes the first step in adjusting is just being able to kind of go, okay, this is going to be tricky, but we'll give it our best shot. So this model, which you probably can't see very clearly up on the screen there, I'll talk to you about it. This is the supportive adjustment for MS, or the SAMS model, that was developed by a group of researchers in the UK. And they proposed that illness-related critical events, such as developing symptoms, diagnosis, relapse, and progression, could often trigger a state of unbalance or disequilibrium, as they called it, and that led to feelings of distress within an individual. Now, they made the very reasonable point that actually acute distress is usually considered very normal and understandable when people are at these points in their illness course. However, if this distress is prolonged, extreme, or the impact of the illness on life roles is disproportionate to the experience of the symptoms, then the person experiences that ongoing imbalance in their life, and that might then be a sign of difficulty with coping and adjustment. And the model at the top really accounts for that piece of the fact that your history, your beliefs, your values, your behaviours, and life goals all have a bearing on how you're going to cope and adjust. So for example, personal to your early experiences might be, do you tend to be an optimistic person, or do you tend to be a slightly more pessimistic? Are you a glass half full or a glass half empty kind of individual? What are the kinds of strategies that you tend to use for dealing with stress, and are you able to apply those in a consistent way with your MS symptoms? So for example, people who have experienced having a challenge with that would be people who maybe would have used a lot of physical activity to manage stress, and who maybe now are finding that because of MS symptoms, they're not able to access that style of coping anymore. And so in the absence of having a different coping strategy to call on, they're having a bit of a tricky time with that. The beliefs that you hold about yourself and about other people are important. It's important for me to be independent in order to survive. It's important for me to be liked. It's important for me to be able to provide for my family. Having a disease such as MS will make me unacceptable or unlovable by others. There are thoughts that people can hold that might influence how well they're adjusting. And then values. It's important for me to look after or nurture others. It's important that I provide for my family. And I'm looking at different ways of being able to do that depending on the symptoms you're experiencing at a given time. There might be behaviours that people hold strongly in terms of, maybe having a really hard work ethic kind of thing that might be a challenge in terms of coping. And then goals that people might have held in life for themselves would be to be financially independent or to have a family, and that's kind of something then that might be thrown up in the air for them following a diagnosis. So a variety of psychological factors can either exacerbate this imbalance that people experience, or it can help to redress the balance and even things out. So some of the psychological factors highlighted in the model include the ability to positively reappraise one's situation, high levels of perceived social support, the use of social support. So I often hear people saying, I've got a lot of great help with that, I have a great family and friends. they don't use any of the help that's offered. So using your social support is really important. And using problem-focused coping strategies, and I'll talk to you about those in a minute. These factors were associated with better adjustment to MS. And then in contrast, high perceived stress, coping by avoidance, and we'll talk about that, not having strategies in place to manage negative emotions and uncertainty. They were associated with poorer levels of adjustment. So these are some of the things that we're going to hopefully try and find some initial strategies to help you with. So you're kind of getting more into that kind of more positive coping style. Okay. And this model fits very well then with the research findings by Taku and his colleagues in terms of the different factors that are involved in positive adjustment. Now, it's important to note, as you all know, that MS doesn't just affect the person with the condition. It's something that has a wider impact on partners, family, friends, and caregivers. And they can experience all of the same challenges of acceptance and adjustment that the person with MS can. The diagnosis of MS impacts the family system. There might have to be a redistribution of roles within, the household. It can impact personal social relationships. It can impact the caregiver well-being as well. The type of symptoms that the person's experiencing can impact what's happening within the household as well. If they're experiencing a high level of cognitive or neuropsychiatric difficulties, everyone finds unpredictability challenging. Everyone can feel anxious and depressed at times. And it can be a sense of anticipatory grief or ambiguous loss. So when you have somebody in your household who's experiencing an illness, and there are aspects of them that have changed, but they're also still the same. So it's trying to kind of work with the same but different, that idea. One of the things that people often worry about and they talk to me about is they're worried about the impact of having MS if they have children or they want to start a family. And actually, the evidence that's there would suggest that children who have parents with MS can still perform as well as children of well parents, neurologically well parents. And what they find is that actually there can be a lot of really positive growth through experiencing adversity. Children can have an increased maturity and increased confidence that enables them to adapt well and cope with an illness within the family system. And while a recent study indicated that the majority of family caregivers are content in their role, there are some factors that can also impact the coping, like maybe being older or having their own health difficulties, and experiencing their own struggles, I suppose, in terms of their psychological well-being. So we have to kind of keep an eye on that too. Positive adjustment in couples is facilitated by several factors. So there's a recent paper published that was done in University of Limerick. And they found that couples who had supportive communication, so they were very clear about what help is helpful, they collaborated well and they shared their experience of illness. So, where partners refer to it as our illness or RMS, that was found to be very supportive and it engendered feelings of closeness. And where there was an alignment of coping strategies and MS management approaches. So there was a mutual validation and empathy between the couple in terms of what was happening at a given time. Yes, this is tough, but we'll work with this together. So it's important that we, support strategy use and coping skills development for family members and caregivers as well, so that they're able to boost their own adjustment in coping. You can't pour from an empty cup. So in order to care for others, it's really important that you care for yourself. And sometimes carers feel a bit bad about taking time to meet their own needs, but it's actually really important. That's what allows you to continue to offer that support. So we can be going along well and then out of nowhere, hit a bump that brings us back to the reality of daily life, living with MS. We see the impact it has when I'm devastated. Well, we're not going to put life on hold, wondering what if. We live in the moment, which isn't a bad thing. So there are kinds of things that people can say. We have to kind of keep an eye on where the wider family system is at too. So, what maintains it? Well, we talked a little bit about coping. Coping is the way in which a person deliberately attempts to manage internal or external stress that they believe is taxing their resources and ability to manage. Emotion-focused strategies aim to reduce the emotional distress triggered by the situation, and they can be things like wishful thinking, hoping for a miracle, or trying to escape or avoid difficult situations or anticipated unknowns. So for example, oh, you know, I'm going to really miss out if I have to leave that dinner early because of fatigue, so I just won't go. So, you know, sometimes what feels helpful in the moment might not be helpful long term. Problem-focused strategies aim to alter the source of distress. I'm going out for dinner tonight, so I've planned a short nap before I go out. So you're trying to figure out, okay, well, fatigue is the issue, how am I going to manage my fatigue to still get out and have a dinner with the people I want to see? But what we find is that people have a harder time adjusting tend to be on the emotion-focused end, and we're going to have to try and scooch them over to being a bit more problem-focused. Avoidance is really important. Avoidance of situations that challenge your identity or that generate a feeling of threat may serve as a form of coping. It's easier to decline a dinner invitation rather than live with the discomfort that perhaps maybe during the meal you might feel fatigued and need to leave early, and then the other negative consequences that can happen as a result. So feeling disappointed or feeling worried that you might think others are thinking of your bad friend or something. Or if someone has faces something that causes a strong sense of embarrassment or shame, or is associated with a social stigma, so for example, sexual dysfunction can be often associated with sexual dysfunction, or with social stigma, even though it shouldn't be, they might not seek help for something treatable because it's easier than facing those uncomfortable and threatening feelings. And this might mean that people miss out on experiences or relationships with things that mean a lot to them and the people in their lives. So avoidance can be costly in terms of the things in life that you value, and they can prevent you from learning that you can actually cope with situations much better than you think you can. And that can lead then to increased anxiety, depression, and disability. So managing avoidance is going to be really important. I have a feeling I'm running very slow, am I? So how we think about things can also influence our adjustment. And we have to be very mindful of challenges with, am I the right one? Yeah. So how we think about things can be important in our adjustment as well. We have to be very mindful of a tendency to engage in what we call cognitive biases. So perceiving, interpreting, and responding to uncertain situations in particular ways. For example, catastrophizing. I'm too tired to go out this evening. Well, that's it now. I'll never get invited out again. So you go from one extreme to the other, okay? Or for example, all or none thinking might be, if I can't walk down the aisle behind my sister at her wedding, then I cannot be her bridesmaid. Or if I cannot work in my current job, then I cannot have a family. So you're kind of very black and white about things. It's all or nothing. And worry then is a thinking process where the person tries to think ahead and anticipate future, potentially negative events and outcomes with a view to trying to find ways to manage or avoid something bad happening. Everyone worries to some degree, but for some it can set off a change of structure, what-if thoughts, that can progress in unlikely and sometimes catastrophic directions. And this actually leaves the person feeling more anxious and apprehensive. Worry becomes problematic then when it gets in the way of living your best life. It also gets in the way of problem solving. But you can get caught then in a bit of a dilemma. If I stop worrying, it might lead to lots of certain benefits like feeling in control or having positive perceptions of oneself as a caring person, for example. So if stress is perceived to overwhelm your ability to cope, then you can feel a little bit helpless and not know how to tackle challenges that you're experiencing, and that can exacerbate then how you're thinking about potential future challenges down the line. So what facilitates acceptance and adjustment then? So being optimistic is something that is identified in the research literature. People who are optimistic and attempt to continue to live their lives as best they can despite the symptoms or changes in function and participation in life activities. People who engage in positive reappraisal of the situation, they rediscover what's important in life, they identify core values and practical ways of living those in everyday activities. This includes learning coping strategies to sit with difficult emotions or suffering. I'll talk about some of them. They're problem focused, they work on what's controllable, they identify areas of challenge and practical ways of lessening the impact of these in their everyday living. And this includes asking for help. It includes using goals to break big tasks into smaller, more achievable ones. And what's important is that people who adjust well see coping as a big dynamic, so they need to tweak their coping strategies at the end again, depending on what's happening for them. So for the rest of the talk, I had anticipated this was going to be halfway point now. For the rest of the talk, we're going to talk about the strategies. Okay, so what do we need to be looking at? Okay, So tackling avoidance is really important, and this is the avoidance beach ball. So if you think about holding an inflated beach ball under the water, it takes effort and energy. And if you let it go, it pops straight out of the water and smacks you in the face, okay? And the bigger the ball that you're trying to push down and keep under, the more energy and effort that you have to use to keep it there. And the bigger the splash it's going to make when it breaks the surface again. And this is a great metaphor for what happens when we're trying to deny or to avoid unwanted, challenging, or negative thoughts. We're trying to suppress them, it takes a lot of effort and energy, and then when these thoughts and emotions resurface, they can cause a lot of distress. You don't have to like those thoughts, you don't have to want them. You might wish they weren't there, but allowing them to actually fall on the surface of the water beside you allows you to find ways then of deflating that beach ball and making those negative emotions a little smaller, so that you can get on with what matters to you. In MS terms, experiencing symptoms can cause you to experience strong negative emotions. They're an indication that something important is going on in your life. I mean, that's what emotions are for. They're like signals for us that something's happening, and that they may be unpleasant. Attempts to avoid or suppress these feelings can cause physiological changes in the body, or symptoms of a fight or flight response. So things like muscle tension, heart palpitations, changes in breathing, lightheadedness, pins and needles, sweating. So not only can these be mistaken for MS symptoms in themselves, but they can lead to exacerbated fatigue, or muscle pain, or headache, or concentration difficulties, and they can impact sleep, even if you're not consciously focusing on them. So learning to sit with strong emotions allows you to process those emotions and the situation that you're in, to use positive coping strategies that ease discomfort and stress and breaks negative cycles. So one way of trying to overcome your fears is to make an avoidance hierarchy. So think of this like, I suppose, a ladder of fears that you might be having. The things that you find the most scary you put at the top, and the things that you scare the least you put at the bottom. And then you provide a percentage of how much they trigger strong negative emotions, like anxiety, for example. And then you confront each situation one by one, starting at the bottom with the things that are easier for you to manage and working your way up. So you're learning in less tricky situations how to manage and cope, and you're working your way towards the ones. So we talked about optimism being important for adjustment. It's really important in boosting resilience. It's associated with less depression and greater ability to see benefits in illness experience. But it's really important to foster realistic optimism. So holding positive expectations about the future that are grounded in the reality of your lived experience, and finding positives in difficult or challenging situations. So this is not about saying everything must be sunny and rosy in the garden. This is around kind of trying to find areas where things can look a little bit more positive over time. So using humour to manage in tricky situations is often something that people try. And realistic optimism can be facilitated by being mindful, noticing negative thoughts and shifting your attention away from them to whatever it is that you're doing in the moment. Noticing the positives. When you do a task or activity, make a note of what went well and what did you enjoy about it. We often forget to look at those things. We tend to look at what things were tricky, but it's about really, I suppose, looking at the situation that you're in and looking at what's helpful. And then practicing gratitude. So for example, every day making a list of 3 good things that have happened. Even on the trickiest days, it's possible to find experiences, people, and things that you're grateful for. I was really grateful for the opportunity to have a chat with whoever over a cup of tea earlier on this morning. It was good to catch up with them. You know, small things, that they can make a huge difference when you're experiencing a time in your life where a lot of things are tricky. And be careful of what we call toxic positivity. So overgeneralizing a happy, positive state that results in denial, minimization, or invalidation of your real emotion experience. So like the bottom of the picture in that meme that goes around, this is fine, it's all fine, things are breaking down around you. Okay, so we want to kind of be realistic about what we're expecting from ourselves. Sometimes when others try to help by pointing out the positives, it can be experienced as shaming or generate guilt, about being sad, worried, not being able to do things. And that goes back to, oh, you look great. No, particularly for the invisible symptoms, such as fatigue, pain, or sensory issues, people can feel, you know, I look great, I must be great, I have to be great, and keep going with that. And sometimes what that means, it means people hide their feelings from other people. They don't want to share how they're doing, and they might genuinely be having a really terrible day, and sometimes it's important that you can kind of say that. So it could be worse. We're devils for that here, aren't we? It could be worse. But it's also okay to say, things can be really tough. How can I support you? You know, that way you can be really clear I want to support you, how can I do it? And the other person can be really clear and actually, this is what will be helpful for me right now. So in terms of managing symptoms, strong feelings, well, we're looking at things like mindfulness and grounding techniques. So some of these may be familiar to anyone who attended wellbeing events in MS previously. So we're looking at coming back to your senses, supporting yourself in what you can see around you. 5, 4, 3, 2, 1. 5 things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, and 1 thing you can taste. It brings you back into the reality, takes you out of your head, and brings you into the reality of every day. Or it might be focusing on the task. I'm washing the dishes, I'm feeling a sense of tingling in my legs. Oh my God, what's this now? Okay, I'm going to focus on washing the dishes. I'm going to feel the temperature of the water. I'm going to smell the smell of the washing up liquid. I'm going to listen to the clinking dishes in the sink in front of me. I'm assuming that some people don't have dishwashers, whatever it is, but you're trying to kind of ground yourself in the activity that you're doing, but really focusing on the details of it. Again, it's about taking yourself out of your head and bringing yourself into the present moment, because that's part of that piece of acceptance. Okay, so you're grounding yourself in the everyday reality around you. Managing symptoms like fatigue is really important. These are some of the hidden symptoms that people can have that are impacting their ability to manage. It impacts up to 80% of people with MS at various different times. It can be undermining of your ability to do tasks with success and enjoyment. So what we advocate is taking a pacing approach. Learn what your warning signs are for your fatigue. You know, what are the signs that maybe you need to take a break? In your body, how are you feeling? Take a break. Prioritize, plan, and pace. Make sure you're building in time during your day for a rest. That's going to be really important. What you find is doing a little bit and having a rest, and doing a little bit and having a rest, overall will lead to you doing more over the course of the day than going a hell of a lot at it for the morning, being wiped out for the afternoon. Cognitive symptoms. Take the strain off the brain. I love a good phrase, and if you come and work with me, you're going to hear a lot of them. Because that's how people remember things, it sticks, okay? Again, about 65% of people with MS will have cognitive challenges, and these will vary greatly from person to person, depending on where the white matter lesions or patches are in the brain. So sometimes people think that using strategy is giving into their MS, but actually what you're doing is you're taking the strain off your brain, and you're giving yourself that opportunity to do the task that you need to do the best that you can. So there's a long list. Having a routine, using a notebook to remember things that you need to do, using checklists, using a pill box to keep track of your medication. These are all really helpful things that take the strain off the brain. Managing stress, be holistic, have a good daily routine, pace yourself, have a wind down routine at night to boost your sleep, make time for social and recreational activities. Sometimes people think that in terms of managing fatigue, well, work is important to me, so I'm going to put all my energy into work, and they don't put any energy into things that give them well-being, like spending time with friends or spending time watching television or whatever it is that you want to do. Those things are really important for your well-being as well. And sometimes we spend a little bit more energy on the social stuff. We might have to feel a little bit tired the next day and catch up with ourselves, but that's actually important to be able to pace in that way as well. Managing mood, the good thing is that despite the fact that people do tend to have a higher level of depression and anxiety, there are also lots of really good talking therapies and behavioural therapies that help to manage those symptoms. Medication is also really helpful as well, so that's an option for people too, and that's often used in combination maybe with talking therapies. This is a therapy model from the work from Denison and colleagues in London. This is a CBT model, but I also use a model called acceptance commitment therapy. So what you're trying to do with acceptance commitment therapy is you're trying to drop the rope of the struggle between you and your MS monster. If you let it go, it has less of a pull on you. So you're kind of just trying to go, okay, drop the rope. And a simple model is be present. Make contact with how you're feeling, make contact with how your body is feeling. Open up, let the thoughts and feelings be without resisting them. We're not going to judge them, we're not going to make any kind of comment on them. We're just going to sit with them and then do what matters. You can actively choose to be present in your surroundings and focus your attention on the task at hand. So you can use the grounding techniques, for example, to help you do that. Being present or being mindful also allows you to notice your inner experiences, and instead of trying to fight or change difficult thoughts or feelings, we're making room for them. We're noticing them with curiosity but without judgment, and we're dropping that tug of war with the monster. We're dropping the rope, and you're grounding yourself in the present moment so you can do what you need to do. So values are things that are important to us in terms of guiding our actions. They represent how you live, what you think is important to you in your life. And it's important that we use our values to drive the goals that we're setting for ourselves. So for example, if you're somebody who values caring, then you might set a goal for yourself of being able to cook a meal for your family 1 or 2 nights a week. If you're somebody who's creative, you might be somebody who will make time to do sketching in the garden for 20 minutes. So your values are driving the things that you do. So for example, that might mean then having to adjust or adapt around that. So if you were somebody who was the cook in the family household, then, and cooking becomes a bit more challenging for you, you might think, well, what can I still do that enables me to offer that to my family? And that might be batch cooking. So instead of having to cook every night, you cook once and you might make meals for 3 months. So these are things and ways of adapting to be able to live your values. So we won't talk about this, because what I want to say is that, life is hard living with any long-term condition, but also particularly for MS. And so it's really important that you allow yourself to know that uncertainty and a level of suffering can be inevitable from time to time. It's not possible to avoid uncertainty, pain, or discomfort. So it's important that you're kind and compassionate to yourselves in the midst of challenge and uncertainty. Paul Gilbert, who is a psychologist who's kind of come up with this idea of self-compassion, he said that it's a basic kindness, a deep awareness of the suffering of oneself and of other people around us, coupled with the wish and effort to relieve it. So it involves 3 components. The first is being mindful or aware of our own pain and struggling without judging ourselves or being critical. It involves recognizing that while suffering is hard, it's a normal part of human experience. So that's part of our common humanity or kind of connection with other people. We all have the experience from time to time, and that's not a failure on your part. And finally, it involves direct feelings of kindness and care towards ourselves. So think about what you would say to a friend in that situation, and can you apply that to yourself? So if you're having a very difficult day, what would you say to a friend, and can you apply that to yourself? And people who practice self-compassion are happier, they're less stressed, and they're more resilient. It takes time to develop, and it takes a little bit of practice, but it's definitely worth doing that. So I'll leave you with this then. MS makes you look at your life. It makes you reevaluate, I guess. What's important, what's not important. Yeah, it really does put things into perspective. So, the idea in Ireland is we have stepped integrated care. If you know about neurology care, you know it's about delivering the right care at the right time in the right place. The reality of that, though, is a bit different, and so what's available can vary depending on where you live. There are a variety of services available, so in an acute hospital setting, you might have access to a specialist neuropsychologist. So, if you are in care of somebody in St. Vincent's, I'm a neuropsychologist that works there, and that's a service that's available. It might be something that's available in community services with mental health teams or with disability services, in primary care with counselling services, or with primary care psychology. And in the third sector then, of course, MS Ireland provide a load of wellbeing services that are there to support you in your adjustment and coping. In terms of psychological care, many psychologists are well placed to offer a range of interventions for people with MS. People often say to me, but I need to see you, don't I need to see a neuropsychologist. But actually, all psychologists are able to help you with things like managing anxiety, managing low mood, managing stress. So do look at what's available to you locally and engage with those if you feel that would be helpful. And then there are also a variety of evidence-based online interventions that are really helpful for supporting adjustment and stress management and mood management as well. So there's digital CBT that you can access via your GP, or the stress control program or the living well program, and these can be accessed online in most places, and in some areas it can be accessed in person as well. So if you're concerned about your psychological well-being, speak to your GP or your neurologist and ask for a referral to be set up. In a crisis, you can contact your GP or your out-of-hours GP service, your local emergency department, and then there are always the confidential listening support services that are available to everyone as well. Don't be afraid to use those if you need them. And there are lots of resources. MS Ireland have a ton of them. They're excellent. One of my favourite ones at the moment is the Unspeakable Bits podcast series online. That's fantastic. I think they had one recently on ending up in a wheelchair, and I think that was amazing to listen to, because that's a real core fear that I hear from people early on, and it's really good to get the perspectives of different people who've had different experiences around their mobility and what they have found helpful. But they also look at other things that are a little bit socially taboo, like bladder and bowel control and sexual function issues. And these are things that maybe sometimes people carry deep down in their hearts, but they're afraid to tell anybody about. And I think this is a fantastic resource for lifting the lid on those things. So what I learned from those is really how many amazing ways people have for living with those kinds of concerns and worries and managing them. And it's really good to hear from other people with MS about how they do that. And then at the top you have a lot of information about the Irish services, and then at the bottom you have the international services that are available online. So for example, the SAMS program is available online. If you put SAMS and MS into Google, you'll get their self-help program manual. It's designed to be done in conjunction with a psychologist in therapy, but it's a fantastic resource nevertheless for you to use for yourself. It has lots of exercises and resources in there that really get you thinking about and reappraising where things are for you after a diagnosis of MS. And there are lots of others, like from Australia and from the US as well, that are fantastic. They have webinars that are online, and they have a lot of resources for supporting psychological well-being as well. So, well over time, I'm afraid.